Hi, my name is Rebecca, and I'm here to talk about the Affordable Care Act and gaps in healthcare for women across the state of Texas. For the problem, one group of Americans face sex-specific challenges when obtaining health insurance, and that is women who are working age. We quantify working age as women between the ages of 19 and 44 years old. Collectively, women pay about $1 billion more in health insurance than men do yearly. And statistically, women actually access the healthcare system more frequently than men, given their traditional role in families. However, they have limited coverage and many barriers to entry that affect them and potentially limit care to those they look after. When the Affordable Care Act was enacted in 2010, the percentage of working age women who did not have health insurance dropped from 18% to 11% up to 2017. However, Texas was one of the 10 states that did not expand Medicaid when the Affordable Care Act came online. Currently, about 1.4 million Texans would benefit from the expansion of Medicaid. Texas currently ranks 50th in the United States for coverage of uninsured women. About 25.6% of women in Texas who are working age do not have private or public health insurance. Every Texas citizen, especially Texas legislators, are major stakeholders in this problem. And this problem is having a huge impact on the state financially, as well as the people that are not receiving healthcare coverage. Now, the National Association of Social Workers take a pretty strong position on healthcare. They say that healthcare must provide physical and mental health services for all people, regardless of class, sex, race, or other demographics. They also recognize that social workers must commit themselves to advocating for those in need. Now, the Supreme Court's decision to limit Medicaid has negatively impacted this population, and they still face inequality when accessing care given the shortage of healthcare providers. The NASW would like to see the full expansion of Medicaid across all states and to see the increase in healthcare providers in the US. This graph really speaks volumes for the healthcare issue in Texas. This is the trends of uninsured women in Texas versus the US. As you can see from the years 2013 to 2021, there's been a slight decrease both nationally and statewide of women who are uninsured, but the top line there with the circles, that's Texas. The bottom line is the average for the United States. And you can see that Texas is very clearly far above the national average for uninsured women. Now, we talked a little bit about consequences, but I want to go into that more because it's more than just consequences for the people that don't have health insurance. There's many economic implications for the state. Now, the state's going to see increased state spending on doctors, hospital, and local governments due to uncompensated care. We also will see the rising cost of healthcare services and insurance premiums. And then again, the high personal toll that goes on uninsured women that can really limit their earning power and their working potential for the state. Now, the solution. Legislators in Texas must vote to expand Medicaid. Expanding Medicaid will significantly decrease the number of uninsured women in Texas and level the playing field of healthcare access to all. Again, Texas is one of 10 states that has not voted to expand Medicaid. And again, we are ranked 50th for insurance of uninsured people, especially women, across the entire United States. And there are only 50 states. Increasing Medicaid coverage would significantly decrease the number of uninsured women in the state. Now, the scary part. By 2040, it's predicted that the number of uninsured Texans will rise to 6.1 million. This huge number of uninsured people will have devastating effects on the state's economy. Without your action, Texas is headed down a complicated and costly road of inequality. Below, you can see my references that I used throughout this presentation. I urge you as policymakers to act and to stop the inequality that we are currently experiencing. Thank you for your time.